KUED presents the Governor's Monthly News Conference, an exchange between Utah reporters and Governor Gary Herbert. This program was recorded earlier.
Good morning. Great to be with you as always. I see we all survived the legislative session, and it's good to be with you. Let me just mention, if I can, kind of recap the legislative session from my point of view, and you might have some questions. But one, I can tell you in my time around the Hill, I don't know that we've had a session where we had so many big issues. We had a lot of issues, but we had some really big, heavy lift issues. Education funding was a big change, and we had significant amounts of money put into education, which I think was a great thing. Actually, about $10 million more than what I had originally asked for. Not quite the way I wanted to slice it up and put it in the WPU, but again, the amount of money, $510 to $515 million of new money, was a significant lift. The transportation funding, which I think was a significant issue, which puts us on a trajectory now to be able to fund not only capacity by 2040, but also maintenance of our roads that we are building. And so I think that was a significantly big issue. We had one that was not quite as, I think, appreciated by the public. It was the criminal justice reform, where we actually had significant effort in changing penalties and classifications for crime, particularly drug possession. More of an emphasis on programming and helping us to eliminate and reduce recidivism. So we're not just warehousing prisoners, but actually trying to rehabilitate them. I think that was a significantly big issue that we got taken care of. And, of course, the one that's in the history books is our anti-discrimination religious freedom bill, which, again, was a significantly big issue and not without controversy. But, again, the legislature did a nice job in coming together and I think threading that needle in a way that most sides are at least comfortable with. Not everybody's happy with everything, but I think they're comfortable with where we've been able to come together. I am disappointed we were not able to address the alternative to Medicaid expansion, Healthy Utah, but we have put ourselves, I think, on a trajectory to resolve that issue. I'm optimistic that working together with the leadership in the House and the Senate, that the executive branch in concert can find compromise and can find a resolution to that issue, which I think is significantly important. So we have left a little bit of unfinished work there of some of the big ticket items. But overall, I think the legislative session was a good one, and I applaud the legislature for getting some good work done and responding to, I think, the needs of the people in a very good way. So good to be with you, but I applaud the legislature for good service for the past 45 days.
Governor, House Bill 11 is probably the hot issue right now. It's the addition of an execution by firing squad if lethal ejection is not available. And I'm wondering how you're thinking about this bill. And are you leaning towards signing it or vetoing it?
I'm leaning towards signing it, and I'll tell you why. The debate really is more than just the firing squad. It's really, should we have capital punishment or not? And we're one of 32 states that believe in capital punishment for the most heinous, despicable crimes, aggravated murder. It doesn't happen often where we have executions in Utah. We've had 7 over the last 40 years. I hope we don't have any. I hope people don't commit those kinds of crimes that we have to, in fact, utilize in execution. But that is the law of Utah. And so when we go through that process and a jury renders a verdict of guilty and capital punishment offense is required, we have to have the ability to carry that out. Most states have some kind of fallback provision. We prefer lethal injection. We would hope that if we hope we don't have to do that, but if we do, it ought to be through lethal injection. But we're finding that it's hard to find those drugs that are necessary to, in fact, perform a lethal injection. And so we need to have some kind of a fallback position. And the firing squad is what we've chosen. Other states have got hanging. Other states have electric chair, gas chamber, and some others have firing squad too. So again, it's not our preference, but we need to have a fallback so we can carry out the court order.
Governor, have you spoken with Director Cook from the Department of Corrections about how he would go about obtaining lethal injection drugs when we would have our next execution, whenever that is?
It's an ongoing quest. Again, for those who are opposed to the death penalty, I understand that debate. And we ought to say, that's a legitimate discussion. Should we have capital punishment at all? But that being said, if we're going to have it, most people think lethal injection is the most humane way to do it. Some have got in their provisions in other states that if in fact lethal injection is found to be unconstitutional, the fallback position will be, in fact, electric chair or gas chamber or firing squad or hanging. So there's different methods of fallback. I believe that we really have a high bar in Utah when it comes to the constitutional requirements to have executions and capital punishment. The challenge we have is some out there that have been producing these drugs are not wanting to be involved with it. I would hope those people who advocate against the death penalty say if you do have the death penalty, we need to provide these lethal injection drugs so we can carry it out that way.
Is it time that Utah starts having a larger discussion about capital punishment and whether we should have it in the first place, given the time, the appeals, the expense?
Yeah, I think any time is a time to have a discussion on any issue, and certainly because of our need to have a fallback position so we can carry out the court order. People expect the court's instructions to be followed. So it certainly is an opportune time to have that discussion. We certainly have a lot of people throughout the country that think that capital punishment is not appropriate. 32 states do. And our bar is very high in Utah. Aggravated murder, it's not just for simple murder, but it's for the most egregious, despicable, heinous crimes possible with a jury verdict. And so we certainly surpassed the bar that's been set to make it constitutional in Utah. And that's why we don't have many of them. Like I say, 7 in the last nearly 41 years.
But Governor, do you know if Director Cook could even get lethal injection drugs, or are we looking at we might end up going through this fallback route? Are we even certain if we'll get the drugs?
It's been an issue for the state prison for some time, and there are avenues to get the drugs, and certainly there's a shortage of them. They're not readily available. We'd have to anticipate, when an execution would come. I don't see anything on the near horizon. Maybe in the next year and a half or 2 years there may be one. We have 8 people on death row in Utah, and they will take whatever steps are necessary to obtain those drugs. So I'm not anticipating the firing squad being utilized, but it will be the fallback position.
Governor, you mentioned the Criminal Justice Initiative, and part of that is instead of putting people in prison, especially people with drug problems and the mentally ill, they'd be treated. But you got to pay for treatment. Part of the plan of paying for treatment was to use federal money through Medicaid expansion or however we might take it. Now we've said we aren't taking it. How are you going to pay for treatment now that you don't have a deal on taking federal money for treatment?
I should have had you hired as a lobbyist up on the Hill to help us get through Healthy Utah, Rod. We'll have to pay it with our own state taxes. It will be some additional costs because we are sending a lot of money to Washington, D.C. that we're leaving there now, at least temporarily, until we, I think, strike some kind of a compromise, and I'm optimistic about that. I'll just reiterate that. But we'll have to come up with the money out of our own state resources that we have here. And so if we're going to have those kind of treatment programs, clearly we're going to have to pay for them.
Okay, but you're going to be turning some of these guys loose. Do you have the money to put them in treatment, or are they just going to be wandering around causing more trouble?
Well, we're not going to have them wandering around causing more trouble. We're going to have programs we'll put in place. Again, it's an evolutionary process here. We're changing kind of the paradigm here that we've had in the past, and we will come up with the necessary money to fund these programs. And I'm very confident about that. We have, $470 million in a rainy day fund. So we've built up our reserves. So we have the ability to do it. I'm not worried about not having the funds necessary to do the right thing.
What other bills, if any, are on your radar as possible vetoes?
Well, there's about 520 of them that we've had passed here. We take a look at all of them. We're just getting the bills now. We track them. We try to work very closely with the legislature so that we don't have a bill that we find inappropriate. I think an ounce of prevention is worth a pound of cure any time. And so we've been very successful to kind of help work with the legislature and direct things so we don't have a lot of bills that need vetoing. But now we're in the process of really the final review. We are the last bastion to stop bad bills from happening. And we take it very seriously. We'll have about 490 bills that will come to my desk here, and we go through every line item. We have a staff to go through them to make sure that there's not any unintended consequences. I don't know that there's a lot of bad bills, but I will actually be given a list here in this next week, and I would guess out of the 490 bills that will come to my desk, there will probably be 25 or 30 that will put in the pile of possible veto or questionable concerns. Do we want to support this and do some very close analysis? But at the end of the day, I expect there will only be a handful of bills that would be vetoed.
Have you thought any further, Governor, about the bill banning wood-burning bans? Whether or not you will
that's
that?
One that's Lee's asked about, that I have some concerns about. To just take out of the hands of our Air Quality Board, which have a responsibility to help us develop, rules that help our environment and air quality, seems to be a little bit of an overkill. And to say that they cannot, in fact, put in place parameters and rules and regulations about wood burn is probably a little short-sighted. So I'm going to take a really hard look at that. I'll just reiterate, wood burning in our valley here is about 5% of the PM 2.5. It's a big number that impacts our air quality. Even though there's only a handful of people that have wood burning stoves, we have many more that have EPA-approved wood burning stoves and fireplaces, but they still put out a lot of pollution of 2.5 particulate. So, it's not a matter, in my mind, of not having wood burn ban. It's a matter of having the right wood burn ban that makes some sense, that's enforceable, that I think the public can embrace. I know the Air Quality Board had 7 public hearings, and the public was very loud about not wanting to have wood burning bans. And so we need to take a hard look at that, and I'm going to take a look at that piece of legislation and see if it's overreach by the legislature in imposing restrictions unnecessarily on the Air Quality Board.
So you're leaning toward a veto, possibly?
I'm going to take a look at it, and I'm not leaning one way or the other. I'm very neutral on this, but I have a concern about them taking away the power of the Air Quality Board that they should have and as necessary to, in fact, put rules and regulations in place that will help us with air quality. You don't want to have the legislature have to put those rules and regulations in place. That's a kind of a super board that would be a little less manageable. We typically give authorization to agencies to put rules and regulations in place with public hearing and comment, and by doing that you have more nimble ability, you have more flexibility, and the public's involved in determining what those rules are going to be, and generally you get a pretty good outcome with that approach.
You've expressed optimism that you can reach a deal with the legislature, specifically with the House, over Healthy Utah. I take it that you talked before the end of the session. Do you have kind of a deal, just some problems, or are you just essentially starting from scratch?
Well, we're not starting from scratch. I think we've identified those areas where there is concern, particularly in the House. The areas of concern are sustainability, which really has to do with can we afford the program. We get a program, and it's a matter of what does it cost us today and tomorrow and over the next decade. So do we have the ability to sustain the program? Rising health costs, being what they have been in the past, causes us pause. We've seen what's happened with just traditional Medicaid. The other thing is certainty. Is there going to be? Are we confident that the federal government will keep their part of the bargain? Will they keep their part of the split? We typically have a 70-30 split with Medicaid. Now we go to 90-10. It would be under the Affordable Care Act expansion opportunities, and taking that money and redirecting it into the private sector. So predictability and sustainability are the two issues that need to be addressed. I think there are answers and ways we can solve that problem and give everybody comfort, but that's going to be what we'll do over the next 90 days.
You already gave them 2 years and out, and they said no. What else can you pull out?
Well, we've come pretty close here. Again, I think, as you've heard the Speaker of the House say, they've come a long ways from where they were going to do nothing and just leave things the way they were to actually be willing to do something. And we're kind of arguing over what the something is now. And they're legitimate issues. I know that the legislature does not want to have somebody on a program and then jerk the rug out from underneath them. I think that's a legitimate issue. I think there's a way for us to, in fact, deal with that. I think there's a way for we can cap expenses going on so we can make sure that we can afford it going forward. So, again, those are some of the discussions we've had. We weren't able to resolve them. We'll have continued discussion on with the legislature, but with the federal government. I'm optimistic we'll find resolution this summer.
You've been optimistic and positive and talked and talked and talked, and it sounds as if you still are. It sounds as if you think you can get most of healthy Utah in 90 days.
I'm optimistic we'll find resolution to the issue. We may have to change the name to something else, not Healthy Utah, but because it'll be maybe a combination of different ideas from the House and the Senate and from the executive branch, and being able to come together and say, I have no pride of authorship on this, frankly. I just want to solve the problem. There are people out there that are hurting. Their taxpayers are paying a lot of money. We ought to respect the taxpayer and get the best bang we can for the bucks they're spending. I'm confident. I'm the eternal optimist that we'll come together on this issue.
On the issue of prison relocation, are you satisfied with what the legislature has done on it so far?
I am satisfied with what they've done because I threatened to veto what they were doing before. And so they've made a significant change. They were going to have just a 7-member commission, which would have all authority and all power to make the decision. I didn't think that was right. You can't cut out the legislature and you can't cut out the executive branch. So under the proposed legislation we have now that's will be coming to my desk, it will require the 7-member commission to go out and identify a place, go through their due diligence and process of finding what they would think would be a better place than the current Draper site, bring that to me. I then will call them into a special session, and the legislature will have an opportunity to vote that recommendation up or down. We'll have the opportunity to participate as the executive branch by putting it on a special session call and having the ability to veto the bill or sign it into law. So again, all aspects of this legislative process I think will engage under this new legislation, and hopefully we'll find a good site that will have minimal negative impact on any community that's so designated.
Last month you were saying, hey, it could possibly stay in Draper. Now are you back on board with it moving?
I've always said from the very beginning, don't read anything more into this than what I'm saying. If there's a better place than Draper, then we ought to find it and put the prison there. If there's not a better place than Draper, then let's keep it in Draper. I mean, that's just kind of common sense. We clearly are at a point where we need to rebuild the prison. And part of it's just the age of the facilities we have out there. It's also kind of a new recognition that programming is a big part of this. Safety issues for those who are the guards out there and the prison staff. So a new architecture, new programming are part and parcel of what we're talking about. In fact, it should be the driving force of this issue. So either we rebuild in Draper or rebuild someplace else. The benefit of someplace else is, and that's a secondary issue for me, is it opens up some real estate for future opportunities there in the two big counties. As Salt Lake County and Utah County are merging together, that becomes a very valuable piece of real estate for future development. I don't think we want to be quick about that, by the way. I think we ought to look for a long-term master plan of what to happen if, in fact, the prison gets moved. But clearly that's some economic opportunity there. And I think the process we have in place now is working well. We'll get a lot of public input, and I think that we can find make the right decision.
Governor, regarding real estate and development in the state, Utah being one of the most arid in the union, towards the end of the session, Representative Ibsen was able to get through his bill 281, which drastically changes the way that water infrastructure is going to be maintained and or created. Some think that this was a way for Washington County to be able to build the Lake Powell pipeline, etc. Tell us how your executive branch is going to be able to interact with the way those funds are created and moved and apportioned.
Well, water is a complicated issue, and certainly one that we all recognize living in the second most arid state here in the continental 48. That we really need to address. Water is the only limiting factor to the growth we have in our state, and we are about the third fastest growing state in America. So it's a big issue. It's not on everybody's radar screen, but it's certainly on mine. That's why I created the Your Utah, Your Future initiative to say, what are we going to do? How are we going to handle the growth that's taking place in Utah? And water's got to be at the top of the list. That being the case, how do we fund water projects? We don't have as much federal money opportunities, for reclamation and reservoir and those kinds of things we've had in the past. The CUP is really the last of those projects, and so we're going to have to find better ways to conserve what we have, as well as develop what we need. The Lake Powell pipeline to access our water that's been given to us out of the 1922 Colorado River Compact is something that really we need to be acutely aware of. And how do you transport that water from one point to another point? And the Lake Powell pipeline is one that's been proposed. How we fund that, I've always said the state may have a role to play in helping with bonding, the ability for us to borrow money to build the projects, but the cost of that should be borne by the users of the water. Should not be a statewide issue. If we're talking about the Lake Powell pipeline, it should be paid for, the bond, the money borrowed to build the project, should be paid by those who benefit from the project. We have the Bear River Basin, which is another area where we probably have ability to develop more water. And again, I would say the same thing there. I think there's opportunities for us to develop more water resources that will be necessary in the future to accommodate the growth. But that benefit from that development should be paid by those who do get the benefit of the development. But it's going to be two things. We're going to have to conserve. This summer is going to be a tough one. We're at about 65% of capacity, our reservoirs. We don't have as much snowpack. I hope we have a wetter spring. I hope we have a wet summer like we had last year, so we don't have the drawdown necessary. But I can see the potential of rationing, alternate days that we water our lawns, and it's going to be a challenging summer unless we get some water.
What do you think about the $5 million fund that was created this session for the Lake Powell pipeline and the Bear River Dam? What are your thoughts on that? Is it enough to advance water resources?
It's not nearly enough to take care of the projects themselves, but again, part of the planning process costs money, so we can actually do a good analysis of, can we afford it? What's the cost to benefit, which is an analysis that should always be done on any project. But you've got to start with some kind of an ability to scope out the project and decide whether it's feasible or not. So I think it gives us a step in the right direction. And like I say, water is going to become an increasingly big issue for this state just because of our growth that's taking place. We have internal growth, we have a high birth rate, but we also have great quality of life and economic opportunity, which is going to attract people from all over the country, literally around the world, to come and set up operations in Utah. So water is going to be a number one issue for us over the next generation.
Back to Medicaid expansion. Do you feel like the federal government will go for a cap on state spending or limits on enrollment?
I'm hopeful. They have caps on other programs, and so I think there's the ability to convince them to have a little more hard cap. We also already have got the agreement to what we call grandfather people. So as people would get on a program with Healthy Utah, for example, or a reasonable facsimile to it, you could, in fact, have people that get on the program and then are grandfathered. They're never off the program. The average length of time, by the way, for people to be on a Medicaid program is about 6 months. And we're in a state where there's economic opportunity. We've added to our program a work effort. So when you enroll in Healthy Utah, you automatically enroll into a work program designed to help you get a better job or get a job if you're able-bodied and get off government assistance. So as people would get on the program, they would stay on it through attrition, they're off. And if we felt like it wasn't sustainable, you could fall back to what we would determine as a more sustainable program, which is like the proposal that's come out of the House. So a combination of those some way could work. That in itself kind of caps the ongoing expense. That being said, I'm prepared to work with the Department of Health, Secretary Burwell, and say we need to have a little more definitive way to cap our expenses so we don't have runaway costs. By the way, most of that has associated with rising costs of health care. Our Medicaid has gone from 9 or 10% of our budget to 20% of our budget today, and is continuing to grow with just traditional Medicaid. That's not because of the Medicaid program itself necessarily. It's because of the rising cost of health care. My disappointment of Washington, D.C. with the Affordable Care Act is it was just simply how are we going to pay the bill program, as opposed to what can we do to reduce the cost of health care. You know, our costs are going up. You hear people, all kinds of stories of operations, and it costs $30,000 or $40,000 or $50,000 for, you know, a 2-day stay in the hospital. The costs are really what's the concern for me, which is not being addressed by any program out of Washington, D.C.
Governor, are you planning on signing the bills dealing with transportation tax increase as well as the property tax increase? And why, you know, considering most people don't like property tax and transportation tax or tax hikes of any kind?
Yeah, most people don't want to have their taxes go up. I get it. I understand that. I'm grateful we live in a state where our tax liability in Utah, all things considered, is about the 10th lowest in America. That's one of our reasons why we're a business-friendly environment. We don't have undue high tax rates. But you have to pay for the government services that we, the people, want to have. Education is a big deal. And so the property tax opportunity here to equalize, which is really the motivator here, is to make sure that people have the ability to have a good education no matter where you're sited in this state. Whether you're in the urban area or rural areas, you need to have the ability to, in fact, have equalization. Last point on that is that, again, we talk about surplus monies, $730+ million, but the real number is $390 million of ongoing revenue that you have to pay. You have to use that money for ongoing. The others are kind of one-time money. So it's not quite the money that you hear about. I think our approach here with property tax and fuel tax increases are very appropriate for today.
Governor, thank you very much for joining us. You've reached the end of our time. We appreciate you being here today.
Thank you.
This has been the Governor's Monthly News Conference. An archive of transcripts, video, and audio is available online. Please visit kued.org. Thanks for joining us.